Hello, this is Dr. Do again. This video is still on alphabetic list problems on letter T. Today I'm going to talk about the temporal arteritis. I think it's probably a addendum video for previously giant cell arteritis. I had it in previous video, and this is the whole realm of giant cell arteritis, referring to middle size or large size of the arteritis. The inflammation could be the autoimmune or could be idiopathic, just cause the inflammation of the middle size or large size of arteries. So this temporal arteritis is one of these realm disease. So basically, let me just bring up the emergency situation associated with this temporal arteritis. Is there any is there any signs or problems associated? Need to see emergency as soon as possible. Yes, this is actually the temporal arteritis is quite urgent emergency situation, because this temporal artery is really branching out the arteries to the eyes. So if this inflammation keep going, and really can impair the vision, most serious complications, loss of vision. So it has to be urgently managed. So what are the signs and the risk factors for those female older than 50 years old and with or without past medical history of the PMR, polymyalgia rheumatica, and develop this headache, and especially the headache and the pulse of the eye pain. If that's the case, really it's the urgent emergency. So do not hesitate, even though probably it's just not exactly, may not or may be the temporal arteritis, but I think on the safe side, just go get it treated, get it evaluated by the physicians, and then to treat it just on the safe side, I think. So this is about the urgent situation. And then, can you manage at home? No, you cannot. If it is diagnosed as the temporal arteritis, really there's regular anti-inflammatory medications like the Motrins or non-steroid anti-inflammatory medications cannot treat this. It has to be managed by the steroid. So you cannot manage at home. So this is about the worst scenario of this temporal arteritis. What are the causes? Actually, could be autoimmune, or could be the idiopathic. Really, could be just the part of the systemic connective tissue disease. But regardless, this temporal arteritis may be part of the PMR, polymyalgia rheumatica, which means the inflammation, non-specific inflammation of the body connective tissues, the muscles, the bones, the joints, and also the arteries, or just the isolated giant cell arteritis, just the blood vessels, middle size and large size arteritis. So this is basically the introduction. In terms of the causes, risk factors, age, about 50 years old, and also past medical history of PMR, and also the other connective tissue disease or inflammation disease. So these are really the risk factors. And also the presentation, like I said, could be typical, could be non-typical. But regardless, if you are having this kind of risk factor, develop this headache, I think it's just go get checked, evaluated. And the symptoms could be like the generalized pain from the PMR, and then you had headache, you thought probably it's okay, just the pain, couldn't tell whether it's headache or whether it's the pain from the other places. Go check it, do not hesitate, do not think that it's okay, I had it for a long time. Probably, particularly if a new onset of headache, that's really not a good sign. Go see your physician. And when you visit the physician, actually the diagnosis is really based on your history, based on the simple blood test, the erythrocyte sediment rate, which is the marker for non-specific inflammation. If this increase the ESR, erythrocyte sediment rate, means there's some inflammation going on in your body. The conformative diagnosis is the biopsy, but it's not necessary. If the presentation is quite typical, and a lot of physicians, actually the recommendation is just empirically just treat. How to treat with the steroid, inject steroid. So that's the pretty much the whole picture of this temporal arteritis. The worst, the complications for not treating on time, eventually, because I mentioned, is the eye, because the artery supply the eyes is branched from this the terminal, and it's the artery to the eye. So that's the consequences. So what are the prevention? Is there any way you can prevent? I think it's part of a PMR. If it is, you can just treat the inflammation in chronic. It's chronic inflammation, then you can just treat it with anti-inflammation medications. But in terms of this temporal arteritis, I think there's no certain way to prevent. Just I think the best way is to identify the symptoms and go check it early and treat it early. So that's basically is the best for this temporal arteritis. There's not like some other, like the gout, for example. It's inflammation, it's the uric acid elevation. You can use the preventive, like allopurinol, to prevent, to maintain the normal level. But this this temporal arteritis, I think just the anti-inflammation medication, if it's part of PMR. Otherwise, I think just there's no preventive measures unless maintain healthy lifestyle, and also treat other comorbidities. Like if you have systemic diseases, if you're a smoker, definitely you need to, I think this is one of the other risk factors, is smoking. So quit smoking, and also exercise, and see your physician regularly to get checked. And also, if you have the signs, if you have previously episode of this kind of problem, if it recurred, then do not hesitate to see your physician. So this is quite straightforward, but it's not uncommon, and the consequences and complications could be very serious. And the treatment actually is quite simple. So if you have those kind of problem, do not hesitate. Just one injection of those steroid will really solve the problem, so you don't need to worry, or you do not need to guessing at home. Is this the serious problem or just part of my PMR? Do not do that guessing. Just go to physician office and to get it checked, or emergency to get it checked and treated on the safe side. I think that's what I mean. Since this is the kind of redundant, but I think just a little detailed explain why this disease is so important. This video is so important, just to remind for those who may or may not have it previously. But I'm going to stop here, and thank you for watching. I'll see you next time.